Welcome to Integrity Linguistics Institute. My name is Dr. Shrikanth and I'm the head coach at Integrity Linguistics Institute, the developers of the OET Exam Mastery app. And today I'll be discussing a little bit about the OET writing subtest, which is definitely going to help you boost your OET writing scores. So, are you ready? All right, let's dive in directly to the session. So in today's class, I will be discussing with you the basics of OET writing, what you need to know before you start. So let me just give you an example. Let's say that you're building a house, your dream house, right? And before you actually begin with the project, you will have a proper strategy, right? You will have a proper plan. Okay, this is the blueprint and this is the plan. And once the plan is really thorough, only then you will start building your dream house. Similarly, when it comes to your OET writing, as soon as you get your question paper, there is no point to jump and write your OET letter. Take your time. You must know exactly how to approach the OET writing task with the right strategies, right? So you must know the basic principles that is involved. And this knowledge is going to help you plan, structure your letter in a very effective manner to help you get your desired writing scores. Okay, and I'm going to help you out over here. Now, if you are going to stick with me until the very end of this video, I promise you, you're going to get, many advantages. Now, the first advantage is that you will be able to recognize the secrets to drafting the perfect OET letter. Now, doesn't mean that as soon as you see this video, you're going to become an OET expert. It takes time. So if you're going to practice as per the strategies, as per the knowledge you're getting from this video, in due time, you will become a pro OET letter writer. In today's class, I will be discussing with you a strategy that we call the careful strategy. All right. So notice the small dots between each alphabet. Yes, that is because the word careful over here is basically a short form for 7 condensed strategies. And those strategies I will be elaborating to you in detail. And this will help you to simplify your OET writing preparation. Sounds good? Yes. And if you stick to the end of this video, you will recognize certain mistakes that many OET candidates make unknowingly or knowingly. And if you recognize these mistakes, the pattern of these mistakes, then you can actually avoid it on your examination day. And that will help you to get even more better scores, right? The fourth benefit is that this video is really going to boost your writing skills for real world healthcare scenarios. Now, the occupational English test, that is the OET, is not simply testing your English language skills. The OET is basically a filter. So if you really want to migrate to developed countries and work there as a medical professional, you need to showcase not only your English language skills, but your professional patient handling skills, right? And the OET listening, reading, writing, and speaking tests you on certain layers of those skills. And when it comes to the OET writing, there are certain unique skills that you need to cultivate and implement on your examination day. I'll be discussing that with you later on. Now, when it comes to the OET writing, you have to understand there is a strict time limit. Your maximum time is 45 minutes. And within this 45 minutes, you have to read the question paper, which is the patient case note. You have to understand the OET writing task, that is what the OET people want from you. And you have to plan your OET letter. You have to write your OET letter and you have to proofread your OET letter and then submit it. So as you can see, you're completing so much of these tasks and you're required to do that within 45 minutes. So time is a luxury over here. And it is very important to make sure you have good time management skills, and that also will be boosted with this video. And last but not the least, I'll be giving you some tips, not some mere tips, but real actionable tips that you can use immediately to boost your OET writing scores. So excited? Yes, I'm also excited to teach you. Now, this is how your OET question paper looks like. So it is not essentially a question paper, it is basically a patient case note. And please understand the OET writing is profession specific. So if you are a doctor, you will be getting a patient case note which is relevant to the doctor's profession. And if you are a nurse, you will be getting a OET case note which is relevant to the nursing profession. Similarly, as your profession changes, pharmacist, veterinarian, physiotherapist, radiographer, so will your OET question paper. This is an example of a medicine OET case note. So every case note is unique. So the OET people are very, very clever. Okay, they are very clever. So they don't repeat the same pattern for each and every case note, right? So as you can see over here, this particular case note looks like this. So we have the name of the patient, we have some background information of the patient regarding the date of birth, the height, the weight, the body mass index, and then we have the social history of the patient, and there they have written the occupation, the marital status, drinking habits, smoking habits, right? And in this particular, okay, so this is the continuation of the same OET patient case note, and here they have written whether the patient takes any substances. Substances basically drugs. So here the patient is not taking any drugs, all right? Now we have information regarding allergies, that is to what the patient is allergic to, and then we have the family history of the patient. So they have written certain historical information regarding the patient's family. So maternal grandmother means the patient's mother's mother. Paternal grandmother basically means the patient's father's mother. Okay, so if you don't know these words, it is very important that you be familiar with these terminologies. So we have the family history over here, and then we have the medical history of the patient. So as you can see, through several years, whatever the patient has suffered, all the conditions is listed out over here under the heading previous medical history. And then we have the treatment records. Now as you can see over here, on 18th June 2018, why the patient came to the hospital, to the doctor. So here they have written presenting complaint, why the patient presented dysphagia. Dysphagia basically means difficulty swallowing. So especially towards solid foods, the patient had difficulty swallowing. And then we have lots of other medication, like medical information is there. So upper respiratory tract infection, there was no relapse of URTI, okay, recent increase in coffee consumption, takes aspirin, and the provisional diagnosis. So what does provisional diagnosis mean? The preliminary diagnosis or the initial diagnosis, that is gastroesophageal reflux disease. All right, so as you can see over here, we have so much of information, and then we have the treatment plan. So the treatment plan is to refer the patient to a gastroenterologist, and the patient needs to decrease her coffee consumption, decrease her alcohol consumption, stop OTC products, etc. Now, did you notice something in the OET case note? There was not a single sentence, right? Everything was written in short forms, like, in code words, using a lot of symbols, commas, okay, everything in condensed format. Because again, you are a medical professional. If you are a doctor, if you are a nurse, if you are a pharmacist, or whatever your profession is, you know how busy our hospital is. So we don't have time to write everything about a patient in full detail. So we'll write everything in short form method, right? Now, that is exactly how an OET case note will look like. Now, this is the most important part of the question paper. Here they have written writing task. So this is the last portion of your OET question paper. And in the writing task, as you can see over here, they have given you a duty. So task basically means a job that you have to do, a duty. So what is your duty here? Your duty here, what the OET people want from you is to use the information in the case notes. So we saw the patient case notes. Say what OET people want is that they want you to write a letter of referral. Okay, so you're writing a referral letter. Okay, you're referring this patient to a gastroenterologist, and you have to write this letter by using the information provided in the case notes. And why are you writing? What is the purpose of writing this letter? For further investigation. So, further laboratory investigation. So maybe blood test, urine test, chest x-ray, etc., etc. Right. So further investigation is needed, and definitive diagnosis of the patient, that is confirmation of the patient's diagnosis, is required. And you're writing to the gastroenterologist, and the doctor's name is Dr. Jason Roberts, and this is the address of the doctor. So see over here, your duty in the OET writing task is to write a letter, a professional letter, all right, using the information in the case notes. But there is a catch. There are 4 instructions that you have to follow. Expand the relevant notes into complete sentences. So relevant notes basically means the important information, the useful information. So why are we writing this letter? Further investigation, definitive diagnosis is required for the patient. That is the purpose of writing this letter. So every information that you select from the case note, all right, it should be relevant to the purpose of this letter. So that sense, that professional judgment you need to develop in you. And once you have selected the relevant information, you have to expand. Okay, so simply copying down is not going to help you get really good scores. You have to expand, you have to elaborate and write into complete sentences. So that is the first rule. The second rule is you're not allowed to use note form. So the short form way of writing, the symbols, the code words, we cannot use that type of writing style. The third one is the letter format. So you're writing a professional letter, you're writing a formal letter. So therefore, there is a letter format. You have to begin with the address of the recipient, the date, the salutation, the greeting, the patient's name, the patient's age, followed by the letter content, and finally the sign off. Okay, so that is a slightly different video. But anyway, I just want to tell you that you are required to write your letter in that professional format. And the content of the letter, the body of the letter should be approximately 180 to 200 words. So minimum 180 words, and I would say maximum can be approximately 200 words. So it can exceed 200 words by a little bit, but not by too much. Okay. So now as you can see over here, this is how your OET writing task as well as patient case note looks like. And you have 45 minutes for 5 minutes reading time and 40 minutes writing time. Now, once you have understood this is what you can expect on your OET writing exam, let's see how to plan. So, preparation is very important, right? So simply without preparation, there is no point in attending the OET exam. It's a very complex exam and it requires a structured planning as well as, proper strategic preparation. So in this particular video, I just want to give you one small tip. So take your notebook or a pencil and write down careful, right? So in order to write an ideal OET letter, this strategy is definitely going to help you out. Now, C stands for clarity. So that is your letter should be very clear to the reader. Further information I'll be giving you. A stands for accuracy. All right. So all the information that you're writing in your letter should be accurate. It should be factual. Further information I'll be giving you. R stands for relevance. So this word you must remember because we saw in the writing task that we are required to expand the relevant notes. So that relevant is very important and the same word is coming over here. R stands for relevance. That is the useful information. E stands for empathy. So you're a medical professional. What is the number one thing a medical professional is required to have? Empathy for the patients. So you're writing for a patient, about a patient, for the patient's well-being. So you need to have the skill to understand the patient's current situation, understand what the patient needs, and write your letter with care, with the intention for the well-being of the patient to the other person. Okay, so that mindset change is very, very important and the OET evaluators will definitely give importance to this. F stands for formality. So what type of letter are we writing? Are we writing a casual letter? Are we writing to friends? Are we writing to family? No, you're writing to another doctor, you're writing to another senior nurse, you're writing to another pharmacist, maybe. So they are all busy professionals. Therefore, your letter is a formal letter, it is a professional letter, and your letter should reflect your professionalism. U stands for understandable. So the reader should never feel confused. Now, if you look into the patient case note of OET, we see a lot of confusing information because the OET loves to confuse us. So if you write in even more confusing manner, then the reader will not be able to understand anything and the score will be much less. So therefore, you need to make sure that you're writing in a manner wherein which the reader is able to understand your message very clearly and very easily. And L stands for logical. That is, your letter should be logical. It should be organized. It should be meaningful. Okay. So this is what careful means. All right. So when you submit your OET letter for correction for the OET, scores, the people over there, the evaluators at OET, they will definitely take into account how clear your letter is, how accurate your information is, whether you have chosen the relevant information, whether you have demonstrated empathy for the patient. They will see how professional your letter is, how easily understandable your message is, and how neatly organized your letter is. So this is what careful means. All right. So very easy, right? Okay. Now let me just dive into a little bit more detail. So C stands for clarity, that is clear. So how clear writing makes all the difference. Now there is a method to write your letter, right? So you can write information in a very confusing manner. You can write information in very long sentences. Now let me just tell you, if I am speaking with you continuously, let's say that you and me, we are having a conversation, okay? And I am speaking continuous, I'm speaking non-stop. You will get bored, right? You'll feel a little bit fed up, right? Similarly, when you're writing a letter, don't, prolong the sentence. Like some students, they are so scared to put a full stop. They just hate putting a full stop. So what they do, they write one sentence which is as long as a paragraph, and they write so much information. They write multiple information into one single sentence. All right. And the reader will lose interest. And not only that, the grammatical mistakes will very much increase. So in order to minimize your grammar mistakes, in order to make sure your sentence formation is crisp and clear, one small tip is to ensure clarity in your writing. So therefore, it is highly preferable if you write short but complete. Short sentences does not mean incomplete sentences. It is complete sentences, but one or maximum two information in one sentence. And keep your sentences direct. So as I told you earlier, you are not writing to a family member. You are not writing to a friend. You are writing to a busy healthcare professional. So they don't have too much time to waste. Therefore, when you're writing, make sure you're directly entering into the point. All right, so keep it simple. Second one, how to write a clear letter. Avoid unnecessary details. Focus on the main issue. All right, so understand the purpose of writing this letter. So in the patient case note that I showed you earlier regarding Miss Ann Hall, what was the purpose? We were writing because the patient need further investigation and the patient needed definitive diagnosis. So that is the main issue, further investigation and definitive diagnosis. So therefore, when you're selecting information from the case note, all the information must be highly relevant to that particular topic. So for example, if you're going to write the family history of the patient's grandmother and the family history of the patient's father, and if you're going to write about the allergic information of the patient, and if you write it in very beautiful English, you are writing basically unnecessary details. You are deviating away from the main problem the patient is currently suffering. And the OET people will not give you scores for that. So recognize which information is important and focus on that. Ensure the purpose of your letter is immediately clear. So when you write your letter, the very first paragraph itself should be purpose oriented. That is, the very first paragraph itself must clearly demonstrate why you're writing this letter, the reason for writing this letter. And in very short, direct sentences, in a very simple manner, you just say, I'm writing this letter because the patient needs further investigation from your side. The patient needs her diagnosis to be confirmed under your expert supervision. Okay, so I'm just giving you an example over here. So without wasting any time, directly, immediately mention the purpose. The fourth one, to write a clear letter, is to divide the content into clear paragraphs. So if you are going to write a letter, let me ask you, how should the letter look like? Now, if you see a letter and if all the information is written in one single paragraph, do you think the letter will look neat? Do you think the reader will have interest to read your letter? No. No one likes to read very long, lengthy sentences and paragraphs. So it is very important that you structure your OET letter into meaningful paragraphs. You can write how much ever paragraphs you want. You can write 3 paragraphs, you can write 4 paragraphs, or even 5 or 6. It depends upon the type of letter and the situation that you are currently in with the patient. So divide the letter into clear paragraphs so that the reader will be able to understand the message very easily. The fifth one is active voice writing style. So this is something that you may need to research a little bit. So there are basically 2 types of writing. So, we have active voice format and we have passive voice format. So I assure you, when you're writing a professional letter, a formal letter, an OET letter, it is highly preferable that you write in active voice. So active voice is basically where you are directly entering into the point. So we have subject, we have verb, we have object, and also it's a slightly lengthy class over here, active voice and passive voice, that I'll be discussing with you later on. As I told, you have to do a little bit research over here. So just learn. If you don't know what active voice is, if you don't know what passive voice is, just learn a little bit regarding that. I'll be helping you as well. But make sure when you're writing an OET letter, active voice writing is more preferable because it has a more professional tone to it. Now, when you write your letter, okay, you must ask yourself this one very important question. Would you understand this letter if you were the reader? So what I'm trying to tell is, you switch the position. Okay, so you are writing a letter to another person and that person is the reader. But just imagine, just for 1 second, just imagine that you are receiving this letter. You are the reader and someone has given you this letter, right? So you ask yourself, so if you are receiving this letter, would you understand this letter? And if the answer is no, then the letter was not a good letter. But if you're receiving the letter that was written by you, and if you ask yourself this question, would I understand this letter if I were the reader? And you look into the letter and you say yes, all the information is very clear. The first paragraph showcases the purpose immediately. Everything has been written in clear paragraphs. The sentences is very short, crisp and clear. Okay, and there is no useless information. The letter is really good. So it is a wonderful letter that you have written. So this is what C means, clarity. Now, what does A mean? A stands for accuracy, that is accurate. Now, accuracy is a non-negotiable aspect in your OET writing. So what does non-negotiable mean? What does negotiable mean? Negotiation. Negotiation is something like, if something is negotiable, that means like that is optional. But non-negotiable, that means it is compulsory. It has to be there. There is no bargain over here, right? So when you're going to submit your OET letter, this thing is compulsory. That is, all the information, 100% of the information that is written in your letter must be accurate. If there is any data error, then the OET people will definitely consider it as a very serious issue and they will reduce scores. So accuracy is very significant. So first and foremost, cross-check the facts, the name of the patient, the dates, the health conditions, the symptoms, etc. So in some cases, you may come across several dates. That is 18th June, this happened. 21st July, this happened. 7th August, this happened. And on these certain days, specific symptoms were noticed. Specific conditions were diagnosed. All right. And when you're going to write this information into your letter, along with really good English, you need to make sure the names, the dates, the conditions, and all the very important medical information, the medicines, the side effects, etc., all the relevant information is reported accurately. Okay, so even if your English is good, but if you write, inaccurate data, your scores will be much less. Use the patient data as it appears in the case note. So what you see in the patient care data, that is exactly what is required to be written in your letter. Do not assume, write only what's provided. So let's say that on 1st August, the patient's body mass index was 26, okay, and the patient was 67 kg. And then on 30th August, the patient's weight increased by 5 kilogram. Okay, so now it is 72 kg. All right, now if you are going to write, the patient did not go to the gym, the patient did not lead a healthy lifestyle, and the patient did not do any workout, the patient was eating a lot of junk food, and that is the reason why the patient exceeded the body weight by 5 kilogram. And if nothing like this is mentioned in the case note, and if you're going to purely assume this, and even if you write in really good English with really good sentences, handwriting as well, you are not going to be getting any scores because that information was not mentioned in the case note. So never judge, never assume, write, report only what is given in the patient case note, no matter how small it is. So ask yourself, every time you write a letter, ask yourself, does every fact in your letter align with the notes? That is, each and every information that you have selected, is it in perfect alignment with the case note information? So it is very important that you proofread a letter. So at least 1 or 2 minutes towards the end of your writing task, you must give in for proofreading. That is to check if there are any errors in your OET writing. So that is accuracy. Now, R. So we discussed C, which is clarity. We discussed A, which is accuracy. And now R. R is for relevant. Now, this is a very important keyword, and it has been mentioned in the instructions of your OET writing patient case note as well as writing task. And I have showed you that as well. So relevant, what does that mean? Relevant means focusing on what matters most. So remember, you're writing about a patient who is very sick. The patient needs medical help, and this letter is going to save the patient's life, right? This letter is going to determine the quality of the patient. So every information that you write must be in alignment with the well-being of the patient. So that is why I told you, you have to focus on the useful information, the relevant information. Focus on what matters most. And how to do that? Highlight the key medical history or presenting complaints. So most of the time, the presenting complaints, the latest complaints will be the most important. So highlight them. So you get a lot of time to prepare, to plan your letter. Okay, so when you're reading your letter for the your case note for the very first time, take your pencil and highlight the key medical information right over there and understand what are the presenting complaints. Next one, prioritize information on the recipient needs for action. Now the recipient, what does the word recipient mean? Recipient is basically the person who is reading your letter. And sometimes you may be writing to a cardiologist. Sometimes you may be writing to a pediatrician. Sometimes you may be writing to a pulmonologist. Sometimes you may be writing to a senior nurse. You may be writing to a physiotherapist. Now you see over here, there is no exact pattern that keeps on repeating. Every patient case note in OET is unique because the OET is very clever, right? So depending upon the recipient, so if you're going to write to a physiotherapist, then you have to prioritize information which the recipient needs, that the physiotherapist needs. You cannot write the same letter to a cardiologist because the cardiologist's role is different, the physiotherapist's role is different. So if you're going to write to a cardiologist, then you have to prioritize information which the cardiologist needs to provide perfect medical care to the patient. Now you see over here, it is not purely your English language skills. You have to use your professional judgment as well. Third information that I can give you is that avoid unnecessary background details. So again, unnecessary, useless information, irrelevant information. So we have to respect the person who is reading your letter. So do not waste their time by writing information that is not required, right? So be very selective. You have 40 minutes to, write your letter. Along with that, you get 5 minutes reading time. So there is no need to be in a hurry. And you're required to write only 180 to 200 words. So spend time planning the letter, preparing the letter, identifying the relevant information, eliminating the irrelevant information as well. Last one is tailor content to the purpose of the letter. So purpose is one of the most predominant factors that must be on your mind at all times, because your entire letter must be purpose oriented. As I told you earlier, we are not writing an informal letter. We are not writing a casual letter. We are writing a professional, a formal letter, right? So there is always a specific reason. There is always a specific purpose to writing your letter. Now, once you have identified the purpose, that is definitive diagnosis, further laboratory investigation, then when you are going to be choosing all the information, all the content that you're choosing must be in alignment with the purpose. That is, all the information must be relevant to the purpose of the letter. Okay, so that is what relevancy means. So once you have finished your letter, ask yourself this question: does every detail in your letter serve a clear purpose? Now, when I say every detail, I mean every detail, every word, every sentence. Is it delivering a service to the purpose of this particular letter? And if it is not, if you feel like this sentence over here, it is not providing any service or it does not have any purpose to the reason for writing this letter, then that information is not relevant information, right? So you need to understand what relevancy means. Now we have finished 3 strategies over here. Now the fourth one is E. E is for empathic, empathy, the heart of professional communication. So if you are a medical professional, you must have taken a Hippocratic oath, right? So as you graduated, you must have taken a Hippocratic oath, wherein which the oath required you to be, to focus on the well-being, to focus on the welfare of the patient. So similarly, when you're writing an OET letter, simply don't focus on the English, like am I using the correct words, the vocabulary, the sentence structures. Just purely concentrating on the English is not sufficient. You have to see this as a real life situation. This is my patient. My patient is going to another person. I'm referring this patient. I'm transferring this patient to another person. And I want the patient to have high quality medical care. Okay, and you really need to understand the patient situation. Okay, the patient is very sick. The patient needs this. The patient needs that. Okay, so you have to plan accordingly. And when you're writing your letter, you must write your letter which so much focuses on the future well-being of the patient. Simply don't focus on the English language and ignore the patient's welfare. So you must have that ability to empathize with the patient whom you're writing about. Avoid judgmental language. Okay, so sometimes you may come across patients who are drug addicts, patients who are obese, patients who lead a very sedentary lifestyle. Okay, So it is very easy to judge those type of people, but we cannot, judge them or make assumptions upon them. You have to be very respectful throughout the letter. And again, these are all very detailed strategies. In the coming classes, I'll be discussing you all this. Third one, suggest actions that show care. So when you're going to write your letter should demonstrate that you actually care for the patient. So for example, these sentences: ensure close monitoring of symptoms. Okay, so kindly ensure, please make sure. Okay, so when you write sentences like this, it actually tells the OET evaluators how much you really care for the patient, and also all the other aspects as well, that is selecting the relevant information, organizing the letter, etc., etc. Again, there's a lot of strategies over here. Balance empathy with precision. Do not over explain. So anything in moderation is good, but when it exceeds a limit, even good things become bad. So do not over empathize. Remember that you are a professional. You are a busy professional with limited time, and you're writing to another busy professional. So precision means accuracy. So all the information must be very precise. It should be very accurate. And of course, you must have that, soft writing skills, that is empathizing with the patient. But that does not mean you overdo it. That is, you over explain certain information. That is then you're basically, wasting your word count. So in moderation, both professionalism as well as empathy will definitely help you out. So what is the one question that you need to ask yourself when you finish writing your letter? Ask yourself this question: does my letter reflect understanding and care? So the next time you basically write an OET letter, you take it and you take a good look into it, and you ask yourself, does my letter reflect understanding of the patient? Does it reflect care for the patient? And if the answer is yes, then you have written with empathy and professionalism. And if the answer is no, that is, we have written only focusing on the, your OET scores. And if there is no, care given for the patient in your sentences, if there is no warmth in your writing, then it is basically not a good OET letter. Okay, so that professionalism you must show. F. Okay, so careful. So we finished C for clarity, A for accuracy, R for relevant, E for empathy, and now the fifth strategy is F. F is for formality. Okay, a mark of professionalism. So remember that the OET writing is a profession-specific exam. If you are a doctor, you will be getting a doctor's question paper. If you are a nurse, you will be getting a nursing question paper. So depending upon your profession, your case note will keep on changing. Okay, so your OET letter should reflect your professionalism. So how do we make sure that professionalism is imprinted in your letter? By avoiding slang, short forms, or informal expressions. So we cannot write like this: hey, yo man, yeah, take care of the patient. I'm sending the patient. Yeah, please take care of him. Okay, so like that. So we're writing as if you're writing to a friend or a casual colleague. We can't write like that. You have to write it in perfect professional manner. Okay, by elaborating. And you cannot write short forms, incomplete sentences. Okay, selecting random information, writing irrelevant information anywhere, and having a lot of meaningless sentences structured here and there, having informal expressions. Okay, so these all do not show the level of your professionalism. Use polite language. Kindly consider, right? So you are writing to another professional, so you have to respect them, and you have to be very respectful to the patient as well. So the language you use, kindly, please take note. Okay, so again, there are certain sentence templates, and if you're enrolled into our academy, we'll be giving you the correct guidance over here. So your letter should have that politeness throughout. Maintain a consistent tone, which is a professional tone. So your letter should have a professional appeal to it, right? It should look professional in certain organized, meaningful paragraphs. The sentences should be very clear. It should be easy to understand. It should all be relevant information, and it should be very polite as well. All right. And as you're writing your OET letter, before you write the content of the letter, you have to greet the recipient. So we call it salutation. So when you're writing the salutation, write like this: Dear Dr. Smith. So if you're writing to a Dr. Smith, then this is how the salutation should be. So see, this is how you showcase your professionalism. And once you have written the address, the salutation, the patient's name, the patient's age, and you have written the letter in a very nice manner, now it is time to end the letter. So the ending should also be in a very formal manner. So have a polite closing statement like, thank you for your attention. Or if you have any doubts, please do not hesitate to reach out to me. Okay, so we call it a closing statement. So what is the one question that you need to ask yourself every time you finish a letter? Ask yourself, does my letter sound professional and respectful? Okay. So again, so even if you make grammar mistakes, even if you make some small sentence errors, even if you write one or two irrelevant information, but if your letter has a lot of professionalism and it showcases responsibility and care for the patient, the OET people will still forgive you and give you the scores, right? So always remember, it is not purely your language skills, it is also these patient handling skills as well as professional communication skills. A is done. Now the second last one is U. U is for understandable. Clarity and simplicity win every time. So if you want, you can write in a very chaotic manner, in a very confusing manner, writing random information in random paragraphs, writing incomplete sentences, overwriting all the information, exceeding the word count, or writing much less, okay, and writing basically which confuses the reader. So yeah, you may have written 200 words, but it does not clearly convey the message that you want to convey, right? So make sure that the reader, whoever is reading your letter, they will be able to understand your letter without any confusion. So see, when I'm speaking with you, if I'm going to speak with you in a manner wherein which you're able to understand my message without any confusion, then you're happy and I'm a successful speaker. But if I'm going to speak by, incorporating a lot of jargon and a lot of unnecessary words, lot of information, jumping from one task to another, writing incomplete, saying incomplete phrases, and being very nervous and saying a lot of nonsense, and if I'm going to confuse you, you will lose interest, right? Similarly, when you're writing your letter, your message conveying skills should be perfect. So use very simple and direct language. There is no need to force yourself to write in advanced English. There is no need to force yourself to write with advanced vocabulary. There is no need to pressurize yourself. There is no need to be over-conscious and write in complex English sentences. If it is not coming naturally to you, do not force it. So use very simple and direct language. Ultimately, what do we want? We want the patient to be safe, to understand the patient's situation, understand which is the relevant information. And once you have selected that, you write it in a very simple manner. Complete sentences. Simple. Avoid overloading sentences with multiple ideas. So this is what I see in many of my students. Students actually write multiple information. They select 4, 5, 6 different information, and everything they write in one single sentence, or they write several information into one very lengthy paragraph. Now what happens is, if you're going to be writing in that particular manner, you're overloading the sentences with multiple ideas, and the chances of grammatical mistakes will dramatically improve, right? And sentence errors will be there, confusion will be there, and the reader will lose interest, and your letter will not look very neat as well. So do not overload the sentences. 1 or 2 information in one sentence. Complete sentences, but short, crisp, and clear sentences. Multiple sentences for conveying multiple ideas. Make sure your letter is understandable. Third one, use transitional phrases to link sections. So we actually call them conjunctions or, linking words. That is, when you write one information, and if there is, you're going to write a new sentence. Okay, so one information, and if you put a full stop there instead of prolonging the sentence, and you begin it as a new sentence. So you can use transitional phrases like additionally, or you can write in addition to this. So you see, you're ending the sentence there and you're beginning a new information in a new sentence. So this will make sure that grammar mistakes are much less, sentence errors are not there, and there is easy understandability for the reader. The last tip that I can give you to make sure that your letter is understandable is that avoid redundancy. That is, again, the irrelevant information, the useless information that does not provide any value to the reader. Every information that you write should be of value. Now, if you're going to repeat the same information, so let's say that a student has written only 140 words, and we are required to write minimum 180 words. And if just to meet the extra 40 words, if the student is going to write the same information, repeat the same information over and over again, then what will happen? That means that the student is repeating the same information, is not giving any value to the reader, is writing redundant information, and the OET people will not give scores to that type of writing. So make sure you are using very clear, simple sentences, prioritizing the patient, you are not overloading your sentences, okay, and you are using good transitional phrases to end one sentence and to begin a new information in a new sentence to ensure understandability. So once you finish your next OET letter, ask yourself this question: is your letter easy to follow for a busy healthcare professional? That is, a person who is very busy. As soon as they read your letter, just by reading it one time, are they able to grasp the most important purpose, the reason for writing this letter, and what they need to do for the patient? And if the answer is yes, if you believe that your letter is easy to follow for a busy professional, then that means your letter has good understandability. And finally, L. L is for logical. Logic, the backbone of a great letter. So plan. I cannot emphasize the importance of planning. Do not directly jump and start writing the letter. Plan your letter, organize the letter, organize the information by priority. I'll tell you what this means. Your letter should be logical, right? So what I mean by is your letter should be systematic. All right. So if you encounter a patient case note and if there is too much relevant information, so let's say that the family history is important. Let's say the current medications are important. Let's say the presenting complaints are important. Let's say the medications are important. So let's say that you're coming across a patient case note with a lot of medical information, which is all relevant as well. Now, what you have to do is you have to rank the information according to priority. Okay. So what is the most crucial information, the most critical information? That you give it the first rank. The second most important information, that you give it the second rank, third rank and fourth rank. So similarly, what you need to do is you need to identify the relevant information and you need to rank them as per the priority, and then you write your letter in a very logical manner. So now you see you are covering the information which is relevant, and you are showcasing professionalism, and you are ensuring that your letter is very logical and you are not overburdening the reader, and you will be able to finish everything within the stipulated word count as well. The second tip that I can give you is start with the purpose and the main issue. So you are writing to a person who is very busy, a cardiologist, a pulmonologist, dentist or a physiotherapist, a senior nurse. So they are very busy people. Right. So as soon as they get the letter, they must know why I am reading this letter, why I have to take care of this patient, what I have to provide for the patient. So from the very beginning itself, mention the purpose immediately. Begin with the main issue. and then as per the priority basis, you explain the information. Again, this all takes time. Okay, it doesn't happen overnight. Okay, so you have to send us letters. Okay, once you join in for admission, we'll be providing you with individual writing sessions, each lasting for about 1 hour with our expert faculties, and we will be giving you digitalized corrections for personalized feedback to make sure that you overcome every difficulty in the OET writing subtest. The third information is support the main issue with relevant details. So once you understand this is the main reason, this is the purpose of writing this letter, then you have to select the relevant information that is going to support the purpose of this letter. So remember when I told you, your entire letter must be purpose oriented. Not only the first paragraph, but all the paragraphs must support the purpose. So that is definitive diagnosis. We have, for example, further investigations required. So you need to be able to write all that. Again, it takes time, but with consistency, we can help you write all these letters in this particular manner very easily. Check for a natural flow between paragraphs. So that is, there should be a meaningful flow of information without confusing the person, okay, without writing in a very unstructured manner. When the reader is reading your paragraphs, after finishing the first paragraph, there should be a meaningful transition to the second paragraph. Similarly, a meaningful transition to the third paragraph. It should feel like a storytelling. Okay, here is you're telling a story about the patient. Okay, so that natural flow, okay, is required. And for this, you need a little bit guidance. You need expert guidance over here. You need proper corrections. Okay, and this also we will be teaching you how to do it. So the next time you write your OET letter, ask yourself this question: does your letter flow logically from start to finish? That is, again, you have planned the letter, you have structured the letter, you are writing the letter in logical, organized paragraphs, and whether the letter has a meaningful information delivery. If the answer is yes, then that is a really good letter. All right. So that is today's tip. So we'll be sharing with you tips on a regular basis. So I highly, recommend that you subscribe to our channel, reach out to us, download the OET Exam Mastery app. All right. So you will be able to benefit a lot from us, and you can enroll to our academy to provide, so that we can provide you the best OET coaching possibly that we can. So what is the strategy that we discussed today? The careful strategy. So careful, your path to OET writing success. So let's recap. C stands for clarity, structuring your letter in a meaningful manner. A, making sure that all the information is accurate. Stick to the facts, no errors, no assumptions. R stands for relevance. Share only what is needed for the purpose, no unnecessary information. 4, empathy. You have to showcase, you have to demonstrate your professionalism and care in the letter. F stands for formality. Maintain a professional tone throughout. That is, your writing style should be perfectly professional. Understandable. That is you. So whoever is reading your letter, they must be able to understand your letter very easily. So your sentence structures should be simple, compact, and meaningful, but complete as well. And finally, logic. Organize your paragraphs for easy comprehension. That is, easy understanding. Okay. So remember this, the careful strategy, carefully implement the careful strategy into your writing practice, and definitely you will be acing your OET writing test. So remember, practice makes perfect. Write and review your letters. Send us your letters for correction upon admission, and we will be correcting your letters with digital accuracy. All right, we'll be providing you customized feedback, and we'll be providing you daily individual sessions as well. Download the OET Exam Mastery app for the latest updates regarding ourselves as well as the OET, and you can refer the sample OET letters from the authentic OET resources. So we at Integrity Linguistics, we only teach our students with the original OET letters, the original OET study materials. We do not give our students any fake any third party, any useless OET materials. We don't do that. All right. And whenever you're writing a letter, focus on the patient's needs, because the patient is the hero. The patient is the hero of your letter. Understand what the patient needs, empathize with the patient, focus on the medical needs of the patient, and similarly, plan your letter. All right. So if you found this OET content valuable, I strongly recommend you like, share, and subscribe, as well as share this video to your fellow friends as well as people who are preparing for the OET. All right. And start writing with confidence today. So thank you very much. My name is Dr. Shrikanth. I'm the head coach at Integrity Linguistics Institute, the developers of the OET Exam Mastery app, and I am signing off. All the best. Have a wonderful day.